turns out as we are acclimatizing, and especially if you're acclimatizing well, we tend to diarrhea, we tend to pee a lot. Oftentimes, climbers that are not acclimatizing well, that are not doing well at altitude, will tend to hold on to fluid. So, a good sign when you're ascending is if you're peeing a lot, that's good news. It's one suggestion that you're probably beginning to acclimatize. Now, if you're not drinking, obviously you're not going to be peeing. But I worry about climbers when they're drinking plenty of fluids and they're just not peeing much during an ascent. I worry that they may be starting to hold on to fluid. And often, not always, but often that correlates clinically with poor performance and the development of mountain symptoms. Another thing that happens to some people at altitude is they'll just start getting puffy, so-called peripheral edema. Now, some edema when you're in the mountains can be due to heat and vasodilation. Some of it can be due to centripetal force. You're driving blood out into your fingers and toes. Some of it can be due to pack strap compression. You get some lymphatic and venous compression when you're wearing a heavy backpack. But a lot of the puffiness, especially in the face, can be secondary to altitude. So what do you do with that? Well, if somebody comes to me in the mountains and says, you know, I'm feeling really puffy, or somebody's boyfriend or girlfriend says, they don't really look like that. They look awful. They're all puffy. I usually spend a bit of time asking them how they're doing. I listen to their lungs. I check them for other evidence of more severe forms of mountain sickness. But usually just having them chill out at the same altitude or maybe go down a few hundred feet is all you need. And these people usually resolve. If you're a doctor type, you can give these people very small doses of strong diuretics like Lasix. These people are uniformly Lasix virgins, so you can give them very small doses of these kinds of diuretics. They'll often go back to their tent, pee off a storm, come back, and they feel better. I do not generally recommend giving Lasix to climbers when they're going up a mountain because you worry about orthostasis, which is low blood pressure due to these strong diuretics.